morning and a warm welcome to today's royal edition of the Crown Breakfast Show. I'm your anchor, Munga. Now, we're going to discuss the importance of the theme, how widely is abortion practiced in Zambia. So today our focus is on the issue of abortion. To begin with, abortion is defined as the deliberate termination of human pregnancy, most often performed during the first 28th week of pregnancy. So now the reason why we are discussing abortion is today, 28th September, is International Self-Abortion Day. Now with me, I have two special guests, Dr. Whyson Munga and Dr. Jean Chirwa. Good morning, Dr. Munga and Dr. Chirwa.
Good morning.
Right, so I'm going to give you time to introduce yourselves, what you do. I'll begin with you, Dr. Jean.
Okay, so my name is Dr. Jean Chirwa. I'm based at UTH, Women and Newborn Hospital. I'm a registrar there studying obstetrics and gynecology.
Interesting. And you, Dr. Munga?
Yeah, so my names, as you have stated them, Dr. Whyson Munga. I'm a consultant gynecologist and obstetrician at the University Teaching Hospital.
Interesting.
Women and Newborn Hospital.
Wonderful. And welcome to our breakfast show.
Thank you.
Thank you so much. Right, so I'll start with you, Dr. Jean Chirwa. Firstly, when was ZAGO formed, and more importantly, what is its objective?
So ZAGO was formed in 2005.
Right.
However, it was officially registered in 2006. So ZAGO basically stands for Zambia Association of Gynaecologists and Obstetricians. So this association basically deals, is an association that is formed of obstetricians and gynecologists. But we also have affiliate members such as the midwives and other supportive staff.
Right.
Yeah.
So, Dr. Munga, regarding the topic of discussion today, we're talking about abortion. For many people out there, they would describe abortion as simply murder. Because it involves putting an end to a living substance, if I may call it that way. So having said that, how would you define and justify what can be termed as safe abortion?
Yeah, so I think I will redefine abortion. I know that there's the term deliberate removal of a pregnancy, okay? But in the real sense, the actual definition of abortion is any loss of a pregnancy before the age of viability. Age of viability is the age of a pregnancy at which if the baby came out of the womb, it would survive. You understand?
Yeah.
So any loss of a pregnancy, because you've used 28 weeks, we'll go by that. Any loss of a pregnancy before 28 weeks, before the pregnancy 28 weeks, is called an abortion. Now, there are deliberate abortions, and then there are others, they are natural abortions. But for the sake of clarity, you'll find that for social reasons, we loosely use the term miscarriage, okay, to kind of paint a bad picture for the other word abortion. But medically speaking, we only have one word, which is abortion. Whether deliberate or natural, any loss of a pregnancy before 28 weeks. Now, when we talk about safe abortion, we do not mean someone deliberately saying, let me remove. No. We are talking about if you lose a pregnancy before 28 weeks, whether deliberate or natural, it is a very dangerous process. People die because they can bleed, they can get infection. So when we talk about safe abortion, what we are talking about is how safe are you helped with the process. Okay, so it can be natural. You are at work, you are pregnant before 28 weeks and you start bleeding. How safe do you acquire services that you are helped out of the situation safely? And again, if for deliberate, I'll put it in brackets, because there are obvious reasons that are backed by the law, where someone can seek for termination of pregnancy. It is prescribed by the law. Now, if you fall in that category, how safe are you acquiring that service? Or are you risking your life going to the aunties, to the grandies, to those hidden pharmacies, to those background surgeries that are not even registered, and then wrong methods are used by unqualified people, wrong people in wrong places? That's what makes it unsafe. So the law of Zambia prescribes what a safe termination of pregnancy is. Okay? So a safe termination of pregnancy is one where it is procured from a registered health institution by law. And then it is done by a registered and qualified practitioner, so that your safety is guaranteed. That's what makes it safe abortion. That's what makes it safe miscarriage. Whether deliberate, I don't like it, I think. Whether you have made a choice to terminate for various reasons, that again should fit into what the law prescribes, or whether it's natural. Okay, how safe are you to go through this process? Have you gone to the right institution? Are you seeking help from the right qualified people? That's what makes it safe. Anything outside this is unsafe. Buying medicines from a medical store on your own, you drink, you start bleeding, going to background, whatever, surgeries unregistered, unqualified people using all sorts of concoctions and, wrong things. That's what makes it unsafe. That's what makes people die. No wonder today's discussion is very critical. People must know that these things are prescribed and you can be assisted. There's no need of risking your life when services can be offered by people that are qualified and gazetted by the law. I wanted to make that very clear. And also from the outset, that Zambia Association of Gynecologists and Obstetricians is not an organization that will support deliberate abortions. It's an association of professional people, as Jean put it, gynecologists, obstetricians, midwives, you understand, doctors that are training to be gynecologists. Now, remember that the primary goal of such an association, these are people that deal with women health. We want this woman, we want this teenager that has acquired an unplanned pregnancy. We want this lady to be safe if at all at one stage in their life they will undergo a miscarriage or an abortion. You understand? So we are there actually to prevent abortions. We are there to promote safe decisions if at all by nature or by choice you happen to undergo the process of abortion. I wanted to make that very clear.
Thank you so much. So I think I'll still come back to you, Doctor. A lot of people shun abortion centers or like institutions like you mentioned because there are rumors that they are very expensive, and a lot of them, especially people in communities, they can't afford the fees. So what is the price range for a doctor to carry out a safe abortion in Zambia?
So as I stated, it's not like you just come, I want an abortion. Pay, you are given the receipt. No. There's a process. The reasons why you want to secure a termination of pregnancy has to be assessed. A history is taken, okay, to fit you into whether you really need an abortion service or miscarriage services or not. So there's a rigorous counseling process. You would be amused in Munga that so many people walk with vague reasons into health facilities seeking abortion, and after the counseling processes, probably more than half have gone back with changed decisions. You understand? Because you are given choices to say, okay, you have this. What are the reasons? You find others are just flimsy reasons. Maybe someone is just frustrated because of a broken relationship. Someone is just afraid of the parents or, you know, the church and other things. But when someone has gone through the whole process of counseling, then they understand the provisions of the law. Then they understand the options of keeping the pregnancy. Then they understand the dangers that are involved with the process of, you know, then they understand what a safe and unsafe abortion is. However, if the services are gotten from a government facility, it's a free service. Get that very correct. If this service is gotten from a government, a public facility, a government facility, it is free. No one is supposed to pay. But when it's procured from a private facility, that's a business. It's a business. You can't go to a private facility and say, can you offer me free service? No wonder it's private. So the ranges of the prices would differ from one private institution to another. But if you do not have money and your reasons, and you have reasons, walk into a public facility, present yourself, present your case. A history will be taken. They will sit down with you. The professionals will go through with you the whole process. They will counsel you so that you make an informed decision.
Just to cut you short, Doctor, a lot of people, these are issues that as the media we have been receiving from young people, especially below the age of 18, those that try to access sexual reproductive health, they usually face discrimination. They get words like, wachepes and umfana and all those things. Do we have such cases, especially in public institutions, where a young girl who wants to have a safe abortion, right? Are they protected enough?
So remember that everything works within the framework of the national law. The Zambian law prescribes a specific age at which an individual can consent for a procedure. So if you are below the age of consent, sometimes that's what brings issues that are misunderstood. For example, a 15-year-old comes, 16-year-old comes and say, I want to terminate a pregnancy. There's a consent form to be signed.
Who consents?
And that's what I mean. Now, the legal framework of Zambia stipulates certain things that can be signed for as consent by the age of 18 and above, and other processes by the age of 21 and above. So, for example, if someone comes and they are under the age of consent, and the process it may involve inserting medicine, it may involve a minor surgical procedure. Who consents for that procedure? You understand? And then practitioners are bound by law. So they would have someone who may be an auntie or maybe an elderly person that can consent for this young person who does not qualify to consent, because if anything happened, who is going to answer? That, you know, I saw a 15-year-old who walked into our hospital and he came and, you know, and then maybe things, you know, maybe there's a complication, you understand? So everything should fit within the framework of the law. Young people, when you fall pregnant, remember you are not alone. If you are below the age of consent, you are not alone. Probably there's someone who has even coerced or sent you to say, go and procure this. Come with someone who is above the age of consent, then there is no problem. I think this must be very, very clear. The facilities try as much as they can to be receptive, to help you, and you will always be helped. But there's a certain things that cannot be hidden completely. At least have a standby, a next of kin. It may not be your parents. It can be your auntie. It can be, you know, maybe someone that is elderly that you trust. Okay? So that the law is followed. It is very important to do everything within the framework of the law. So do not shun coming to the facility. At the same time, do not cheat each other. Young people are fond of living on rumors and what they hear from their friends, even when they've not experienced such. So they'll just start a story on the social media. Hey, when you go there, they will chase you. No one has even been chased, but it's a story that is ignited from the blues. Feel free. These facilities are there to help you. But when you come, for example, and you are guided, oh, you are only 15, you are only 16, do you mind coming with a next of kin who can sign for you? They are not chasing you. They are saying, let's do everything within the framework of the law so that you are protected, even the practitioner is protected. I think that has to be very clear.
Right. So I'll come to you, Dr. Chirwa. I know laws of abortion vary from one country to the next. So in this regard, that we are celebrating World Abortion International Day of Abortion today, because of this, how many countries recognize and even support this day called the International Safe Abortion Day?
I think it's basically all the countries that are subscribed to safe abortion. So you'll find that different countries have got different laws. You'll find, for example, in Islamic countries where they have their own laws with regards abortion. However, there are quite a number of countries. We can take, for example, the US. We can take, for example, our neighboring country, South Africa. We can take, for example, our neighboring countries like Malawi. Those do support safe abortions. So basically, countries that subscribe to safe abortions do recognize this important
Interesting.
day.
So I understand with regards to this day, obviously there are policies that surround this particular day. Are they revised from time to time? Because as we go forward, we have things like technology keep evolving.
Basically, when we're looking at abortions, of course, yes, there are different policies. But then, of course, like, as Dr. Munga has said, everything has to be done within the confines of the law. So when you're looking at the law of Zambia, there's actually an act of parliament which was enacted in 1972. So this law was actually revised, I think, about 2 years later in 1992 to 1993. So this particular act of parliament is supported by about 4 other statutes. Okay, so we're talking about the Zambian constitution itself. And when you look at the Zambian constitution, it will give you the rights, the Bill of Rights. Then we're also looking at the Professions Act, because when we're talking about the Professions Act, we're basically talking about the act that's governing us, the providers of that service. What are we supposed to do within the confines of that particular law to carry out that safe abortion? Then we have 2 others. We have there's a penal code as well. Yes, and I'm sure I can't really remember what the other one is.
Right. So I'll still come back to you. For the sake of our viewers, remind us about the major dangers. I'm told Dr. Munga has just highlighted some of them, but then give us in detail what are the major dangers that come as a result of an abortion.
So unsafe abortions basically are these abortions which are not performed in the confines of the law. An abortion which is not performed by a trained practitioner, right?
In a wrong place.
In a wrong place, okay. So you will find here's this, because basically besides it being performed by a safe abortion, being performed by a health practitioner who is trained, there are prerequisites, okay, part of which has to do with infection prevention, okay, which is like our main focus. So when you come to the hospital, all these procedures will be carried out in a sterile environment. Now imagine you are just for the sake of discussion, 18-year-old, and you have Vana Chimbusa, or let's say the auntie, who stays just by the corner. Now picture her home, okay? I just want you to picture her home. And you want to procure this abortion, and she tells you, okay, I can do it for you. Yes, because she's well recognized by the community. This is someone who everyone goes to, and she decides to perform this abortion. Like Dr. Munga had said, there are we follow a certain procedure. It has to either be medical or a minor surgical procedure. Now, a woman goes to this place and now she's bleeding and things are not coming out completely. So now she has to be cleaned. Now imagine what kind of instruments they're going to use to clean. Number one, already this woman is predisposed to bleeding. Hemorrhage, which is one of the important causes of maternal mortality in most of the developing countries, right? Then number two, this woman is predisposed to infection. Imagine in an unsanitary environment where things are not even sterilized, you don't even know where the knife went. Maybe it was cutting meat, maybe this knife was cutting whatever, then you start inserting it in someone. The third part is, we've talked about infection, the third part is loss of that vital organ, okay, the uterus itself. Injury. So
to the uterus.
To the uterus, and also where people insert bottles, wires and whatnot. They'll push those things way up. They start coming out with bowels, matumbo, intestines, you know. Now imagine the long-term morbidity that is associated with that, the complications of passing fecal matter, of losing your uterus. Because at the end of the day, if you lose your uterus, let's say at 20 years or 21, that means that you are sentenced to a life of not having children. So there are social and economic factors associated with that. It's expensive on the part of the family because at the end of the day you develop abscesses in your pelvis. You come to the hospital. It's expensive on our part to treat you. Imagine where your relatives need to constantly come and visit you, bring you food, you know, like diverting the little resources that they have for the family to now taking care of this one particular person in the hospital. So really the magnitude is quite huge. That's why we are saying we're not, at the bottom line is we're not promoting abortions, okay? But we are saying within the confines of the law, this facility can be obtained safely from our hospitals. And I think one of the questions you had asked earlier on is what are the objectives of ZAGO? So one of the objectives of ZAGO is to ensure that there is a reduction in maternal mortality and morbidity. Now, one of the areas that we have identified to be the major cause, which is about, I think about a few years ago, was standing at 13% mortality rate associated with unsafe abortions. You see, so now one of the areas we identified is how are we going to help our country as professionals to reduce this burden of morbidity and mortality associated with unsafe abortions. So you find that one area of interest is that of safe abortions and safe choices. Yes.
Right. So Dr. Munga, I want to know, or maybe you have something to say.
I wanted to add something.
All right.
Yeah, it's a very important part of the program. Yeah, what are the dangers? Okay. So first of all, currently, the 2018 demographics show that not unsafe, just abortions, maternal deaths, meaning those pregnancy-related deaths, okay, that are as a result of abortive outcomes, stand at 7% for the country. Though for other places it can be a bit higher, some specific isolated areas in Zambia. But as a country, for 2018 demographics, the contribution of abortions to mothers dying due to pregnancy is at 7%. That's a huge percentage. Had these people, you know, gone to seek services at a health facility performed by qualified people, would we be talking about 7%? No. Absolutely not. That's what we are talking about. The most important thing is to prevent abortions. How do you prevent abortions? By preventing unwanted pregnancies. I want to speak to our young lads, the millennials. Okay, millennials, please. You are too advanced to be, you know, to be found damn wanting. I mean, you know, you are too clever. You are the millennials. Number one, if you can abstain, okay, from sexual activities, please, if you can, please do. If you can't, please use some protection. It could be, you know, condoms. It can be various family planning methods. The ultimate goal is that you should never have an unwanted pregnancy, because that's what leads to what we are talking about. Millennials, you are too clever for that. Now, the dangers of abortions, there are two methods which are used to procure an abortion, especially the ones outside the confines of the law, even within the law, but I will explain. Yeah. So the purpose and the aim of these people that do these things is they just want to get rid of this baby. They want to get rid of this unborn baby because either the pregnancy is not wanted, there's rejection, there's fear of the unknown, there's all these things. So they will either give you something to drink or to insert. Now, it can be a wide range of different things. It can be ranging from medicine, it can be herbals, it can be these things. When someone gives you so that it destroys something in your body, that thing already becomes poisonous. Now, remember, the aim is take this, combine this, drink this, add this, so that the baby dies and it comes out. Do you know what happens? The dosage is not measured. Aye? And that medicine is probably not designed, whatever you are taking is not designed or qualified to be used for such a purpose. But anything toxic can do anything. Yes, the baby can die, it can come out, you start bleeding. But was that medicine, was that substance intended or initially intended to be for that use? No. So don't use wrong things. No wonder go to a health facility. Don't use things that are just people have come up with concoction. It's dangerous. What people forget is that when they give that to get rid of the baby, the same chemical, as dangerous as it is to the unborn baby, it's dangerous to the same mother carrying that baby. We have seen a lot of ladies, women and whatever, come with kidney failure. The kidneys have packed as they were trying to target the baby, but those chemicals do not, like, they don't have eyes like in one lane to the uterus. You understand? It's moving in your blood. We have had people come with the total kidney failure because they took something and gazetted for that purpose. We have had this mother come, with liver failure. The liver has packed. The kidneys have packed because you used the wrong substance, whether taken by drinking or swallowing or by inserting. Napapata, it is very dangerous. It's one of the complications. Maternal kidney failure, maternal liver failure. And then there's the other issue of, surgical. Jane was trying to put you into the picture. Surgical procedure kunyumba. How? Okay, what are they using? Wires, it can be cassava sticks, and what? Do they even know where the uterus ends? So they will poke you through. It will perforate, it will go through your uterine wall, even go to the intestines, and they will continue poking. The intestines are being perforated inside, the uterus is perforated. When the uterus is perforated, what happens? Okay, you can bleed to death. Okay, when that uterus is perforated with things, ku hospital timashoka vivintu, we sterilize them in the machine, burning, so that there's no bacteria on what we use. And then kunyumba just wash with soap, with atichani surf and whatever. It is wrong. You end up with infections. Jane talked about pelvic abscesses, or even indeed abscess in the whole abdomen. Your bowels or intestines have been perforated. People have come with dead intestines, where you need to cut large chunks of intestines out because they were poked and they've died off. You understand? What about the pain? This lady is being poked without any painkiller. Without any painkiller. It's open your legs. It's your auntie talking now. Huh? Mugwireni, maybe there are 4 people or 2 people holding your legs. Choco inside, you know. The cervix is lacerated, you are bleeding. Later on, you know, these infections can now complicate even for your future. You fail to have a pregnancy at the right time now when you are ready. Then you start remembering, maybe it was that time when I went to Chawama. You understand that? You do not need to risk that when they are qualified people. And later on, another complication is incomplete evacuation. You'll find because they are not professionally trained, they will not know if everything has come out. They will leave some things and those things easily rot. We've seen people coming with you know, bad stains and the person has wasted, like lost weight and so on, sepsis. Yeah, so na Papa, why go through the risk of your life when there are people that are qualified and they are not working from outside, they are working within the confines of the law, and they can help you to safely come out and to guarantee your future.
Right. So before we continue, just a reminder to our viewers, in case you're just joining us on today's edition of the Royal Breakfast Show, our topic of discussion is how widely is abortion practiced in Zambia? Feel free to interact with us. Those that are watching us via Topsa Decoder, channel 89, there's a number scrolling on that yellow ribbon. And those that are alternatively following us on our Facebook page, you can do the needful. We would like to hear your views, we want to interact with you. We are here for you, and I hope you will feel the honor. So Dr. Chirwa, I'll come back to you. You know, for somebody who has never had a miscarriage or an abortion, or whatever it is difficult for them to differentiate between having menses and bleeding. Like, how would you know to say maybe you took morning after and it worked, and then you are looking forward to having your periods, and then you're not sure with that, am I pregnant? How am I going to know these are periods? This is an abortion or a miscarriage. How do you tell them apart?
So first and foremost, a morning after is not an abortion pill. Let's get that straight. Okay? It's a contraceptive. Okay? So when we're talking about an abortion, we're talking about something that's forming inside, and you are terminating it. Already formed. Okay? But with the use of emergency contraception, there's nothing that has formed there. There's no fetus. You are just preventing the formation.
So the thing is, those things, people say, we have actually heard, or maybe people say they're not 100% reliable. Somebody can take a morning after and then it doesn't work. Maybe they're even pregnant. You know?
Then it depends on when you took it, because if you take it, if you take it before fertilization, chances are that your fertilization will be pushed forward, so you will not get pregnant. But if you take it when you've already fertilized, or rather ovulated, it's not going to work. Dr. Munga, right?
Yes.
I see. So how do you differentiate between periods and somebody who's had a miscarriage? You don't know, you're confused.
No, but then when you're pregnant, you're going to basically have the telltale signs of pregnancy, right? So pregnancy will basically be defined as a period that has been missed. So if your period is supposed to come during a certain period of time and it doesn't come, you've missed that period. And then basically by about 6 weeks or so, you should start having pregnancy symptoms. But if you don't, let's say by 4 weeks you realized, okay, my period was supposed to come on the 20th and it didn't come, the first thing you're going to think of is maybe I'm pregnant, right? So you would think of doing a pregnancy test, right? So then how are you going to take a morning after pill days way after you have missed your period? So if you are going to take, I think one of the things that we really need to educate our women also is on sexual reproductive health is the correct use of contraceptives. When do you use the emergency contraceptive pill? How do you use it? What is this emergency contraceptive pill that you're talking about? What are the family planning options? What other options besides the pill do I have which can act as an emergency? So the typical emergency pill is taken 72 hours, which is within 72 hours of that unprotected sexual act. Okay, so I have unprotected sex today. Within 72 hours, I should be able to take that for it to be effective. So the longer I take the emergency contraceptive,
serving a purpose.
Exactly. So the higher the failure rate. If I take the emergency contraceptive now, the chances of it failing become really slim. But if I take it 3 days later or so, ovulation would have taken place, the sperm would have met, I'm not killing anything, it's already there, it's not an abortion pill. You understand? So with regards to emergency contraceptives, you realize that you've had unprotected sex, come to the hospital. Don't start going to these unsolicited pharmacies that people go to where they're going to sell you drugs which are probably expired, because people want to make a living by the end of the day. So there are different options we can give you. We can either put a loop, okay? There are two different types of loops that we can insert in you. Those also act as emergency contraceptives. We can give you the pill. Those also act as emergency contraceptives. If you don't have that, we can give you the typical contraceptive pills, but at a certain dosage.
Now,
So,
bleeding, whether if the pregnancy is very small, sometimes the bleeding can look like normal menses, can look like normal periods. That has to be very clear. So in case you are worried and you do not know, do a home pregnancy test in
And
urine.
it's only 5 kwacha.
It's 5 kwacha. If it's expensive, it's 10 kwacha. So don't bother yourself with doubts and what when you can get a 5 kwacha, buy and dip in your urine. It will show you if you are bleeding and you are pregnant, or you are bleeding, you are not pregnant. Simple as that. Now there's abuse of emergency contraception. Emergency contraception should fit into the word emergency. It's those contacts once in a blue moon when you least expected it has happened. Then you say it's an emergency. Let me take an emergency pill. Do not use emergency pills as routine contraception. It can disturb your hormones because they are hormones. It can disturb even your flow, your menstrual flow or your periods. So emergency as it is, it should only be for emergency. Not every day when emergency, when done at home pocket. What? Na papat. If you know you are active and you are regular, go to the health facility in the family planning units. Ask, like, I'm active, which methods, which options of family planning do I have? So that you use a method that fits your activity. But if you are not active, maybe after 6 months, vachitika, you understand, then you are justified to use the emergency for that purpose. Na papa, not because I have seen a lot of women and ladies that are fond of inankala ni routine. At I always use ka emergency.
Every month.
Every kazaku sokonezera ma periods, it will just disturb your body. No wonder that question, the bleeding, now you are confused. Is it the pill? Is it the what? Is it, you understand?
Yeah.
Use the appropriate product for the appropriate condition. So let's use these morning after pills or emergency the way they are designed to be used. It should not be routine. They are routine contraception, routine family planning methods that you should go for if you know you are regularly active.
Interesting. So, Dr. Chirwa, is it possible for a woman to get pregnant even after an abortion, or does it reduce her chances of conceiving in future?
So I think I'll borrow Dr. Munga's words. It depends on who performed the abortion, how it was performed. Because if you procured, let's say, this abortion in one of these so-called hospitals or surgeries, and it was not properly done, you see the way I'll give a typical example I'll give of the woman's womb is a bed. Every day when you wake up in the morning, you spread your bed, right? You make it clean, remove all the wrinkles and whatnot, right? So that in the night when you come to sleep, it's nice and fresh. Now imagine a situation where you want to sleep and this bed, you've been sleeping on it for months and months, so yanzika. now all those my bread, the food, the dirt, the what, getting on top of that of that bed, is it comfortable?
No, it isn't.
So the lining of the uterus is made in such a way that once you disturb it, okay, and once you disturb that, there's a complication that is called Asherman syndrome. I don't know the layman term, but I'll try and explain it. So what happens in this condition is that okay, things inside hold together. So you have no lining where this baby is going to come and fall on. But if we do it for you, not that we are saying come, we'll do it. No, it's not. I want to emphasize the fact that we are not promoting. But should we do it for you, we'll do it in such a way that we take care of that lining inside, so that, yes, preventing complications, so that when it's time for you to have another baby, when it's intended, you can have that baby without any problems. So what makes people not to have these pregnancies is because of the way the procedure was initially carried out.
Right. So due to time, I'm going to be quick.
Okay.
Right. So one of the most common methods of abortion is the use of Panadol and Coca-Cola. And I see Dr. Swebi Macha here from ZAGO, who says on the record, he's on the record of discouraging this practice. Firstly, why is he discouraging this? And secondly, explain to us what science happens when Coca-Cola and Panadol are taken to induce abortion.
I want to say something before my boss says anything.
Right.
So the bottom line is this: if you're going to do it on your own, okay, it's not safe. And Dr. Munga said there are so many drugs out there that you can use. There's a lot of other products that you can use to terminate the pregnancies. But those are not gazetted medications that we use in our hospitals to terminate a pregnancy. Remember, he also mentioned to say you can take different chemicals that will not only affect the baby, but will affect you. You know, one of the main common complications of an overdose of paracetamol is that you're killing your liver.
Liver failure.
Liver failure. And
So was Panadol meant for abortion? No.
no, it wasn't. Was
Right.
Coca-Cola meant for that? Now imagine you are mixing one toxin thing and the other. So of course, no, we will not say go and take Panadol with Coca-Cola mixed with Sprite and whatnot. No, 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 that's science. We don't understand it,
You
but
want to
we
say
just
something?
don't do it.
Yes, thank you. So basically, those are some of the wrong and gazetted things that are used. We do not even have the science to tell the total effect that would have. You understand? So do not use things that are not meant to be used for such a process. So Panadol is meant as a painkiller. People have committed suicide with Panadol. I hope you know, eh? Yeah, so we don't know how many tablets they take. We know what they'll be doing, just knocking down their liver. So the babe will die. Few weeks later, the mother will die because the liver has been knocked out. So it's not actually discouraging. We are just saying stop it. Stop using wrong things. Panadol is never meant for procurement of an abortion. Coca-Cola is a nice, soothing juice, soft juice. That is softish and drink.
Soft drink.
You understand? It was never meant for that. There's a lot of carbon. I can imagine kuti bakumwa Coca-Cola mabotolo yangati. How many bottles? Until you are full with the gases and everything. Come on. Do not use anything that is not gazetted. How can you arrive there? Is by coming to seek advice and to seek proper things that are gazetted for such purposes. So that is a non-issue. Stop it. Don't use anything that you don't know. No matter how common. You said it's one of the commonest.
It's one of the common use.
Being a common does not make it right.
Exactly.
So it's one of the most dangerous so-called commonly used.
Concoction.
So we're told that, in a nutshell, we're told that 50% of female condoms end up getting expired because of low use in Zambia. Firstly, how true is this? And secondly, does this directly contribute to the high levels of unwanted pregnancy that often results in abortion?
That's a very tricky question because we don't have vital statistics to support it.
Interesting.
However, I think one of the challenges around is the ease with which women access family planning methods, okay? And also the ease with which a woman can simply walk into a pharmacy or any health center to ask for contraceptive, right? Because I think that in as much as there is a role being played by healthcare providers, there's also a different role that's played by the community and by the individual themselves. You know, there's this mentality of, in Christu, so when I go to ask for condoms, they'll be asking. Because I remember one particular incident, a scenario that someone gave to say, okay, I went to ask for condoms, but then when I went there, I found this lady who goes to the same church as my mom. So when I saw her, I was like, no, I can't go ahead and ask for the condoms, because then they'll go and tell my mom, or they'll go and tell the people at church. So I think, truthfully speaking, it starts with us. I think if we're moving around with all this much stigma surrounding the use of a certain product to prevent yourself from unwanted pregnancies. By the way, condoms do not only prevent unwanted pregnancies. You should know that they also prevent diseases. Sexually transmitted diseases. So they'll prevent you from syphilis, from gonorrhea, from HIV. So, which is something that the traditional contraceptives, the oral contraceptives or the IUCDs will not do for you. So yes, we're saying we don't have statistics to say female condoms expire, but most likely it's because our male counterparts are more courageous to go and source for these products than we are. Because if I'm moving around with a condom in my bag, then the assumption will be that that one is a slut. Why is she moving around? Because that's what even the community paints. That's what our male counterparts paint us to be. I move around with a condom. I'm like, Monet, no, safer choices. I take out my condom, like, how many other people do you take out that condom for, you know? So you decide to shun away. But yes, I think it would be good for us to have statistics on how many women do use the female condoms.
Right. So, Dr. Munga, does ZAGO have any activities lined up with regards to the observance of 2021 International Safe Abortion Day?
One of it's this same program. So there are a lot of awareness programs where we are having TV, radio programs, just because the main purpose is to create awareness that while procuring an abortion or a miscarriage, it must never be dangerous for you. It must be safe. So there are TV programs, radio programs, and there will be some, I think, little walk. Yeah, and you know, so those are some of the activities. We want you to be aware that you can be safe even through the process of an abortion.
Interesting. Thank you so much.
Actually, we're supposed to be a large panel. Some of the members have gone for other activities. Others are in Eastern Province. Others are in Kabwe, others in Kafiwe. So yes, there's a lot of sensitization that's taking place.
Interesting. No, as Crown TV, we are honored to have you. And we're obviously looking forward to engage you more so that we should continue to educate our viewers out there. And this has been your host, Namwenga Mwenga. Until next time, good morning and God bless you.